So I think the last couple of years, particularly on the back of the pandemic, have revolutionized certain aspects of healthcare in the country. Obviously, there is a lot more focus around the demand supply gap, which is on the infrastructure side. And so, therefore, you see a great momentum in terms of that India needs more beds. You can see that over the last 2 or 3 years now, there is a big change in terms of medical education and the number of new medical colleges that are being set up, which means that the demand gap which was there, or the supply side gap which was there on the clinicians front, hopefully over the next decade will get now filled up to some extent. While we cannot undo the last 40, 50 years, but we can undo at least for the next decade. So that's good. And I think the last but not the least, the role of technology in healthcare sort of has come to the forefront, that healthcare needs a lot more technology based solutions rather than just people based solutions. So I think we are probably on the path to become more efficient and more productive as healthcare enterprises.
So how did you and your organization deal and grow with the evolving healthcare ecosystem?
So we at Asia Healthcare Holdings are basically focusing on single specialty healthcare. We built out India's second largest oncology chain of hospitals between FY17 to FY19. We currently run the Motherhood Hospital chain, which is in the mother and child segment. We run Nova IVF Fertility, which is on the fertility side. Through my other role in TPG Growth, we have invested behind Dr. Agarwal's, which is an ophthalmology chain. So we are playing our role, as one can say, in different areas and specialty areas in healthcare. Besides, of course, the multi-specialty hospital chain, which is Care Hospitals in India, which is a part of our portfolio. So pretty much a much wider ecosystem of healthcare that is being powered by all of us.
So good. So lastly, how do you find the theme which is redefining Indian healthcare system of today relevant, and what do you think of it?
I think for any sector and for any a sector is like an organization. You need to give it the seeds of change, and you need to also then keep on putting new thought processes, new challenges in front of them. India's healthcare sector needs to get redefined. If India has to live a better life, if India has to be more productive, if more and more, if India has to meet up with the demands of future healthcare needs of its citizens, India needs to look at the foundation that we have today, because that foundation is a mix of both the public and the private side. India has grown on the back of private capital for a very, very long period of time. We need a lot more healthcare delivery to be rooted in this country. We need more clinicians, we need more nurses, we need more manpower across the healthcare ecosystem. At the same time, we need a lot more healthcare infrastructure and more beds. We need more diagnostic services. So I think the redefinition of India's healthcare is a function of policy, which is the government's enablement. It's a function of more and more private capital coming into the country and powering the growth of the sector. And last but not the least, it's as much about innovating new services that all of us can put into the sector so that the patients get a much better quality of healthcare than what they even get today.